Welcome to How to Revise the BNF. In this lecture, I'm going to be focusing and showing you tips, techniques on how to revise your BNF, how to use your BNF to prepare for your pre-reg exam. One of the common questions I get from so many pre-reg students is, how do I revise the BNF? What do I need to study? There is so much information. How do I extract the relevant information so that I could just focus on this to pass my exam? So this lecture essentially is just showing you those key areas, answering this question, showing you what you need to revise, how you can revise, simplify this BNF, and use this knowledge to succeed in your exam. So I'm just going to go straight into the lecture. So I'll just go into the next slide. Right, so just about me, my name is Marvin Munzu. I'm a pharmacy manager, a superintendent pharmacist. I'm a BBC featured media pharmacist, also the author of the book Success Secrets for Students. So I've got a lot of experience working, motivating, and supporting students succeed, both pharmacy students and pre-reg students. I'm a personal trainer, an ambassador for Pharma Fitness. I'm an international speaker, pre-reg coach, coach many students, over 500 pre-reg students over the past years. I'm also a community pharmacy manager, and I received an award for Community Pharmacy Manager of the Year. I was a few years ago shortlisted for one of the top 50 most influential pharmacists. I'm also a UK natural national bodybuilding champion. So that's a bit about me. And just to show you what we're going to cover today, we're going to focus on different ways to access the BNF. We're going to look at the BNF content, what you need to get out of the BNF. We're also going to look at the key areas to focus on when revising. So what are those relevant areas that you could place more emphasis on so that you could literally maximize your time and the input that you put into your revision. We're going to look at different high-risk drugs, the high-risk drugs that you need to know, pediatrics, where to extract relevant information. And also we're going to look at some important updates which you need to know, or changes you need to know in BNF. So I'm very excited, and I hope you're excited too. And yes, so let's go into the next lecture. So there are three ways that you could access the BNF, right? So you could either access it online, and I do that personally using Medicines Complete, or you could use your app on your mobile phone, or you could use the standard print version. So in these lectures, I will be using the BNF 76, and this is the most recent. Well, this is from September 2018 to March 2019. So for those of you doing your exam in June, I recommend that you use the most up-to-date BNF. So we've got three ways we could access this BNF. Personally, I stick to two ways. So I recommend obviously having your print version, because when you're studying, you want to have a print. And I also use Medicines Complete, the online version. Now, what's the difference between the online and the print? The main difference is with the online version, you get monthly updates, right? So you get those monthly updates. And so I always go online, my online version, because they're updated constantly. So if you want to get the most updated information on your BNF, you want to go into the online, because that's updated monthly. Right, so the next thing I want to look at is the content and the chapters. So essentially this book, your BNF, has got 16 chapters in it, right? So what I've done to make it easy for you is to highlight the most important topics. So as you know, with the Gphc, these 16 chapters are giving a weighting. So there are 4 high weighted chapters, right? And that all that means is you need to spend about 70% of your revision focusing on these 4 key chapters. So if you look at the chapters in red, I've got cardiovascular system, which is the big one, nervous system, infection, and your endocrine system, or some people call it the endocrine system. So these are the 4 main ones. And 70%, well, 65 to 70% of your revision, of your time of studying this book, has to be spent on those areas. So if you look at the blue ones over here, let me try to use my mouse. Yeah, so if you look at the blue ones, I've got M, those are your medium ones. So these are about, say, 35 or 25 to 35% of your time you need to spend on these ones. So you've got 5 medium ones. You've got the respiratory, the genitourinary system, you've got your immune system and malignant disease. You've got the blood and nutrition, and then all the other ones. So you got your gastrointestinal system, and all the other ones are your L's, which is your low-weighted topics, okay, or chapters. With these ones, you could just spend only about 10%. The mistake that most students make is some students decide to completely ignore the low chapters. But my advice to you is do not ignore any chapters of the BNF, because there are certain times when the GPHCO in the past has actually asked more questions from low-weighted chapters. So please don't do that. Please don't do that. Make sure you read everything. However, focus 70% of your time on these 4 main chapters, okay? Read everything, but place more emphasis on the 4 key chapters, and then your 5 medium ones, and then the lower ones. Okay, so like if you see my notes, I make them so easy, and we do clinical lectures. We also do one-to-one. You can look at the slides. It's so easy for you, so I could absorb that information and you can apply the information as well, with the ultimate goal to pass the exam. So these are the weightings I've put out there for you, straight from your pre-reg manual, your GPHC framework, the outcomes, the high rating ones, the ones in red that I just highlighted to you. This is what's going to come. Most of the questions you get 60% to 70% will be tested in the exam on the high rating ones, and then 25% to 35% will be the medium, and then up to 10% will be a low rating. What this means is that spend more time, up to 70% of your time, as I mentioned, on the high rating ones. But make sure you read everything. Okay, so let's go on to the next one. Right, so the content, the appendixes and the indices, very important, very, very important. The 2 key ones are your Appendix 1, right, which has got your drug interactions. So you need to know your Appendix 1, you need to know key important drug interactions, and there's some common ones that you need to know that will normally come in your exams. And there are 4 appendices, but I will say you want to focus on the first one, which is Appendix 1, which has got interactions, and then you want to focus on Appendix 3. So 1 and 3 are the main ones. Appendix 3 is your cautionary and advisory labels for dispensed medicines. So those are little cautions that you have about every medication, and this normally comes up in questions, or what sort of advice you can give to certain patients on certain medications, for instance, with your diabetic drugs, or with your antibiotics, or with some of your respiratory drugs, your inhalers. So that's really important. Or that's your indigestion tablets, on antacids, the many things that we're going to go through in the lectures. So key things for you to remember, okay? Appendix 1 and Appendix 3 are the most important ones. Right, so another thing to note before you read this BNF, we're going to go through this, is your high-risk drugs. So on top of everything, you need to also focus on the high-risk drugs. Why do you need to focus on high-risk drugs? Because each assessment is likely to include at least 1 question, right, on each of the following drugs or the group of drugs, okay? So each of your assessments will be likely to include, so your exam that you're preparing for is likely to include questions from at least, well, of all of this, either from these drugs or from this group of drugs right here. So it's important that you spend a lot of time on these areas as well. All right, so another thing which most people ignore is your pediatrics. I can't stress the importance of focusing as well on your pediatrics, because 20% of questions in your assessment will be related to pediatric patients. So 20%, and that's a huge, huge amount, and that can make a difference between a pass or a fail. So very important as well. So I'm just showing the key parts, the relevant parts, the most important parts for you, so you focus on these parts and you smash that exam completely. Right, so another area I want to show you is just the side effects. Now, with side effects, I'm just showing you this just very quickly, but it's important to know about your side effects. But also important, we're going to come to this later on, is what the different classification of side effects. But the main ones to focus on the first 2, very common and common. So very common simply means it's more than 1 in 10. So more than 1 in 10 people will experience the side effects. That's very common. And common is between 1 in 10 to 1 in 100. Those 2 are the main ones for you to remember. Right, let's go on to the next slide for you. Right, and yes, so the next thing I want to look at now is the typical layout of the monograph associated with your medicinal forms. So when most students ask me, and I do a lot of one-to-ones, I do a lot of training, a lot of coaching with pre-reg students. We do a lot of calculation sessions, and now we're doing a lot of clinical lectures as well. We've got a 6 weeks clinical course. One of the big questions, this is the most important part. So when people ask me, or if you're asking yourself right now, you're watching this and you're asking, how do I revise the BNF? How do I get the most important information? What do I need to study my BNF? This book looks so big and I don't know what to get out of it. This is the area that I'm going to focus on now. So how do you break this down, and how do you get just the right information that you need in the right areas to produce the right results? So we're going to go through this, and what I've done for simplicity is I'm going to use this BNF and I have to go through the pages. What I'm going to advise you right now, if you're watching this video, please get your BNF and go through this with me. It's easier if you go through these lectures with your BNF, then you can see exactly what I'm talking about. So let's look at the monograph. Let's look at the layout of your BNF. So if you open your BNF, you see I put on the 165 to 167. So if you go to page 165 to 167, well, just go to page 165. This is the layout of the BNF. So you've got your class monograph, and a class monograph is simply all the information common to all the drugs in that particular class. It's very important that you make notes from the class monograph, and I'll tell you why, and also from your drug monograph. But your class monographs are very important. So open the BNF, go to the class monograph, page 165. You go to page 165. So I've got page 165. I'm going to try to see. I don't know if you can see that. Probably not, but probably not too clear for you. But if you have your BNF right now, you see BNF 76, thiazides and related diuretics. So this is what we call a class monograph. If you can see that, let me bring that a bit closer. Can you see that? So that's your class monograph, and that contains the information that's common to the class of drugs. So in this case, what's common to all the thiazides. And your class monograph, so make sure you read this part first. You read the class monographs first when you're going through your BNF, and then you move to the second one, which is your drug monograph. Your drug monographs contains all the information about that specific drug. So it focuses on a single drug. So first thing you want to do is you want to first read about the class, then you read about the single drug you're trying to study. Okay, so if you go on to page 166, so just turn that over, you will see I've got indapamide, for example. So that is a drug, and indapamide, you can see that's indapamide's drug monograph. So you will get questions if you're revising your BNF, if you want to go into the drug monograph and you want to focus on specific things. So in here, the next thing is you've got what we call synonyms, right? And synonyms are not a big deal, but synonyms simply means certain drugs have different names. So if you go on to page 121, so we're going to go back and forth flipping, but it makes it a lot easier for you to understand what I mean. So rather than just saying it, because I like to be interactive, because that helps you and that stimulates your brain, as opposed to having this boring lecture of just talking to you without getting you involved. So if you go on to page 121, you can see, for example, you've got aspirin, and underneath aspirin, you can see that underneath aspirin, you've got acetyl salicylic acid, which is simply another name. So sometimes you have synonyms for drugs, which you have the name, but you have another name for that drug. Okay, so that's an example of what that means. So let's go back to page 166. Right, so we're going to go back now into your drug monograph. So first thing you do is you read that class monograph, you get some information about what's common to all the drugs in that class, and then you need to focus on some specific drugs. So that's how the GPH asks questions. So you have to learn about general classes, and then you also have to know about some specific drugs in a class. So let me take indapamide, for example, so I could see the layout. So next thing you want to read is you want to go into what we call your drug action, okay? So make sure you read the drug action, especially with specific or single drugs, okay? Go into the drug action. Not all drugs will have the drug action laid out, but I'm just showing you an example. So for instance, with indapamide, we have here indapamide is a thiazide-like diuretic with anti-hypertensive effects. At lower doses, vasodilation is more prominent than diuresis. The diuretic effect becomes more apparent with higher doses. So that just shows you how it acts, mainly related to it being a vasodilator. So that's important. So you go into the drug action, you learn about the drug action for that specific drug, you make notes on that. Then you move to the next thing with your indication and your dose. Very important. You need to know what the drugs are for. You will get this in your questions. You will get this most of the time about indications, what are certain drugs used for, or what sort of doses do you need, or the maximum dose. So to get that information, you just have to go underneath. So you get indications and dose, right? So we're still on that page. So if you go on there, you see indications and dose. And then you can see on there, tells you the adult dose, which is 2.5 milligrams daily. It also tells you take 1 in the morning. So that's important. That area when you're studying or you're making notes, just go into the indications and then see what the dose is. And certain drugs have the maximum dose, maximum daily dose. You want to put that down. All right. I'm going to go on to the next one. Okay, so next thing here is your cautions. So every time you're studying, and the good thing is when you read the class monograph, you will have the general cautions and things about the drugs, all the drugs in that class that are common. But then specifically when you go into a single drug with the drug monograph, then you come on that cautions. Cautions are very important as well. So you need to know the cautions with drugs. Certain drugs have certain cautions that you need to be aware of. But we go through all of this in our lectures or in the clinical course. Okay, so next thing, which is absolutely important. I can't stress the importance, and we do have notes as well that are based on just the key interactions you need to know. So we're going back to this Appendix 1 I was talking about. The next thing is when you're making notes, you want to write out the interactions. So what sort of interactions happen between certain drugs, okay? So you go into interactions, and that's the next thing you want to make notes on. So you need to know your key interactions, your key drug interactions. For instance, you have, say, like macrolides with your antibiotics, or your macrolide antibiotics, sorry, with say a statin, right, simvastatin and erythromycin. So different interactions that are very common that will come up in exams. You just need to know them, and we have a list of them. So once you have that, the next thing is your side effects. So if you go below, you need to make notes on the side effects, and this is where it comes back to the slide I was talking about, which side effects are very common. Anything that's greater than 1 in 10, that's very common. You need to focus on the very common side effects. And then you could also learn about the common ones, but the ones that are more than 1 in 10, because when you're a pharmacist, your advice you give patients will really be based on the most common side effects. The next thing is any allergies. For instance, some people have a penicillin allergy, so you won't get this in many drugs. For certain drugs, it's very important that you know about the allergies and the cross-sensitivity, okay? And then, very, very important when you're making your notes is to focus on pregnancy. A lot of questions from the Gphc will be from pregnancy or what sort of advice you give to pregnant women. Also, remember, you're not just studying for an exam, but you're studying to be an effective pharmacist, to be an efficient pharmacist, to be a successful pharmacist. And for that to happen, you need to think long term. So you're also learning so you could provide an amazing service to this patient once you're out there. And you get a lot of pregnant women and breastfeeding questions that come into your pharmacy. And it's important that you know about pregnancy. So in every single drug monograph and also in the class monograph, you will have the next section down there. That's how it's laid out. You have breastfeeding here, which says it's present in milk. But yes, that's very important, okay? Another one, you need to read about the patient and care advice. Patient and care advice is also very important because this is actually the area where pharmacists give advice. And you see that with some monographs, they do say, all right, you should give this advice. This is what you will give as a patient to the patient, or this is what the carer will have to advise the patient, right? So these are important counseling points. So if you go on to page 200, just show an example. Let's go with me, page 200. I know we're moving back and forth, but that's the whole idea. So if you go on to page 200, on the statins, that's a class monograph. If you go, you could see patient and carer advice. Advise patients to report promptly unexplained muscle pain, tenderness, or weakness. So patient and care advice is very important. And I find that a lot of good patient and care advice is mostly in your class monograph sections. So make sure you read that and you search out for the patient and care advice. Okay, I hope this is all making sense to you. Let's go on to the next one. So you got your hepatic and renal impairment. So this advice on the drug about how it affects, the renal, your renal function or your hepatic function. So yes, this is also important. You wouldn't get as many questions on this, but it's also important that you look into that if there's anything that's highlighted. So like renal, for instance, when you're dealing with things like digoxin, you need to know about how things might affect the kidney. So the next thing, which is so important, absolutely important, focus on this full of energy because this will always come on your exam, are your monitoring requirements. So when you're reading from the monograph, when you're studying BNF, you need to look for what you need to monitor. And again, we have a list where we show you the key drugs with the key monitoring requirements, right? So for example, This will specify what you need to monitor the drugs. You need to be very careful, especially with narrow therapeutic index drugs. So an example, let's go to page 109. One of my favorite drugs, digoxin. I did a video on this on 2 kidneys. It's very good. You need to watch it. Yeah. So if we go back here, so monitoring requirements, you go to page 109. We've got monitoring requirements there. I don't know if you can see that. I'm trying to bring that closer. The monitoring requirements, you have for plasma digoxin concentration assay, blood should be taken at least 6 hours after a dose. Right, this is the important part now. Monitor serum electrolytes and renal function for digoxin. Toxicity increased by electrolyte disturbances. So that's very key information, and potential questions will come from this small section right there. All right. So what do you need to monitor with patient on digoxin? It could be a single best answer. Which of these do you have to monitor? And they could put a couple of drugs down, and they might put kidney function or renal function, or what sort of electrolytes with digoxin especially. You need to watch out for potassium. So they could put that down, and you just have to choose which one it is. Very important, your monitoring requirements. And finally, directions for administration, also very key to know how to take, because it's advice you're going to give patients how to take each medication. So you need to know your directions for administration, especially. So this is how you learn. Okay, this is how you make your notes. So what I've just shown you now, these steps, that's what you need to go through to make your notes. Especially, let me go back when you were talking about this high-risk drugs. Okay, so you see all these high-risk drugs. When you make notes, you need to follow this structure, which I've just shown you. Make notes on them in that format, and then you find out you learn a lot, and you have precise, concise notes. But throughout the whole clinical lectures, I've got notes for you. All right, so we go through every single chapter. I don't know if you can see on here, but I've got about 172 slides. This is not just for this part. This is because we have all of that topics, your GI, the CNS, the respiratory. We have everything. All right, so and I'll show you a little taste of this later. But okay, that's fine. That's what you need to follow. And then yeah, so we'll literally come towards the end. Some main things. Now, I want to show you something which most people ignore. And the reason why this is important is because you could potentially get questions on this in your exam. And that's why I spoke about having the online version of the BNF as well, as along with your print, is because you have changes that happen each year, updates, and the Gphc likes asking you questions on current things that are happening, right? So you need to be aware of the current changes that happen each year, and you just pick that up in the pharmacy, especially from the MHRA. Look for those MHRA advice. You look for the drugs that have been recalled. It's so important that you know that. So now the changes that have happened, there's so many changes that have happened in the that have happened this year. But if you go on to page 236, right? If you go, that's your asthma. So I'm just going to show you the change that have happened. So important MHRA advice and warnings. There's been a change in the asthma guidelines, specifically on the chronic part of the asthma guidelines. So it's important that you know, and also the difference between your BTS sign versus your NICE guidelines, because there are a few differences in terms of what they recommend and what they consider as children, and the different things that you need to learn. Okay, that could come your exam, and they love the respiratory and asthma. The GPC really loves that. So make sure that you learn about the changes that have happened there. You've got Brotus. That's been a change this year. We've had that MHRA advice because there's been a risk for patients actually swallowing the capsule. So all this advice says is that as pharmacists, we need to advise the patients not to put those capsules in the mouthpiece, but to put them in the center, the center chamber, but not in the mouthpiece, because I need to have one of those. I hope all of you have seen like the Brotus inhaler. If you haven't, then you could just look at the leaflet, or you could look online. But that's many patients have swallowed the capsule in accident because they put it in the wrong section. So that's why that's a serious advice, and you have to advise patients. That could come up in your exam. Next change, you've got dihydrocodeine and paracetamol. That is codidromol in the pharmacy. And the risk of this is many people have overdose patients because your codidromol, you've got 10 milligrams of dihydrocodeine and 500, then you've got 20 milligram strength, then you've got a 30 milligram strength. But what doctors used to do in the past, it just used to be prescribed as codidromol, and that was okay because codidromol really means just the 10, right? But what happened is sometimes people mistakenly give the 20s, people mistakenly give the 30s. So all the advice is that doctors, prescribers must specify the tablet strength and the dose to prevent any overdosing. That's all it is. So now if you look at the prescriptions, you will see codidromol, but you see it's going to specify if it's 10 milligrams from 500, or whether it's 20 milligrams in 500, or whether it's 30 milligrams, that has to be specified, and the dose has to be specified as well. So that's a change that's happened. If you go to page 451, you're going to read more about this. With Vartis, if we go to page 248, you're going to read more. And then the emergency contraception has been updated. The guidance has been updated as well as the malaria prophylaxis. So there are many changes, but these are the key ones that I've identified that you need to be aware of. Now, let me show you the most important of all these changes. One that is really big, and this might come up in your exam, is this one here. All right, let me go to the next one. This is the change because we had to do this in the pharmacy, and we had to communicate with the doctors, and doctors had to change patients that were on this and recall a number of patients. And oh, why is my slide jumping up and down? That's strange. Okay. Okay, right. I don't know, my slide is jumping up and down. Yes, I was going to show you the next slide. For some reason, it keeps jumping up and down. But yeah, so the next slide really, it's is the next caution here. So important change. This is a very important one. It's your valproic acid. So if you go to page 351, go me to page 351. Page 351 here, you can see I've actually put, it's a very big MHRA advice there. Very big one, because that's how important it is, okay? Don't know if you can see that, but I've actually put a box in it. So this is valproic acid, and as most of you know, or you should know by now, that any woman, or so women or girls of childbearing age, there is a potential of this causing fetal damage. So it's recommended that all the patients, and doctors had to recall all patients of childbearing age that were on sodium valproate or your epilim had to be recalled, because this can affect the fetus, okay? And the only time when doctors or prescribers can prescribe this item, can prescribe valproic acid, is only when the conditions of a PPP are met, which is a pregnancy prevention program. That's the only time this can be prescribed, okay? So the advice for pharmacists is anytime you dispense sodium valproate, epilim, to a lady or woman of childbearing age, you need to make sure that you give them the advice about how this can affect fetal development, especially if it's someone that is planning, right, on having a baby. You need to advise them, and you need to make sure you refer them back to the doctor, or make sure that all the conditions of the pregnancy prevention program are met before this patient's actually on this item. Very important. This may come up in your exam. All right, so that's key. These are the key areas. In a nutshell, that's exactly what you need to know. That's how you need to revise for your exam. That's how you need to make your notes. And finally, okay, so I've got chapter 1. I'm not going to go into this now, but these are the next lectures, just to show you that we do a lot of, we're doing a clinical course. We do them throughout the year. And just to show you some of the things that we do so much. So if you're struggling with clinical information, I'll give you an example. So if we look at chapter 1, for instance, gastrointestinal system, you can see we have all of this for you. Diverticular disease, diverticulitis. I'm just going to show you briefly our notes, just to give you a little taster. We've got so much on there: inflammatory bowel disease, Crohn's disease, the main things you need to know, complications. In the exam, you will get a lot. You see your drugs for treatments like your aminosalicylates, very important drugs. You have things on your IBS, the symptoms are important to know. And yes, just showing you a little bit of, there's so much there, constipation. You don't really get as many questions in this area, the GI, but you do get, because this is just a medium weighting, but you do get a lot of questions on the different types of laxatives in your exam. So you need to know different types of laxatives, the treatment, and you have all of this. I could keep going through this. I'm just giving you a taster of our notes. We've got a lot of notes on every topic of the BNF, and you see how it's laid out so simple for you. It's so effective for you with just concise, right information you need to know. It took a lot of time to do this. Antacids are important for you to know in this chapter. Also, the PPI, Helicobacter pylori eradication, what you need to know as well in this chapter. You get questions in it. So antacids, you need to know about aluminum and magnesium, which ones are laxatives, which ones are constipating. So these are just common. I'm just showing just general things in it, but we go through this on our clinical course. But yes, so that's what I wanted to show you. There's a lot more stuff. If we go into if I just show you this, there's so many slides that we have. But if we go into even your cardiovascular, which many people struggle with, we have amazing summary notes on the cardiovascular system. It's unbelievable. I'm giving a lot away now. Okay, let me just show you something. Those of you that struggle with cardiovascular, let's show you the difference. This is like arrhythmias. This is like really cardiovascular stuff right now. The main things you need to know, and following the BNF. So all the lecture notes are in this order of the BNF. and everything is laid out for you. So easy, highlighting in red, making it big for you so that you could pick this. It's just amazing. It's amazing. So thank you very much. I'm going to stop there. The whole idea of this video was to show you how to use your BNF. I hope you've got some good tips that can help you to use your BNF. I hope you can use this now to make your notes for your BNF, focus on the key important things in the BNF, follow that layout, focus on the changes, make sure that you use the print copy, also get on online version of BNF so that you can get all the recent updates, and stay positive, stay positive, stay positive. You can do it. Many others have done it. You can do it too. I remember one thing: more students pass this exam than fail the exam. So you have every single bit of potential to succeed in this exam. I've helped so many students succeed, and I know 100% you too will succeed. So stay positive, and if you're interested in joining us, get onto www.the-pre-read shortcuts. So www.pre-read shortcuts. I'm going to put the link at the bottom of this video. You can get more information. You can join our clinical course. You're always welcome. Any challenges with clinical, give us a shout. Take care. Bye.